Hi guys, it's Ryan here with Sigma Survival, and today's video is about 12 uncommon first aid items that are pretty much in nobody's kit. Okay guys, so I've made a list here of 12 items. I tried to cap it to sort of 10 and I ended up going to 12. So two of the items are more advanced, but the others are just things that everybody should have. So these items are designed to empower you to not have to go to hospital as much, to not have to rely so much on these sorts of systems. It sounds crazy, but most people's first aid kits are very generic. They just have a few bandages, they have some plasters, some triangular bandages to sling the arm up or to apply splints, which most people don't even know how to do that anyway. CPR face shield and some wipes. This is generally speaking what I've found to be the most prevalent items in most people's first aid kits. Now, there's nothing wrong with those items. You can definitely use them for a lot of different things, but you're also capped as to what you can use them for. Anyway, so let me get into the list. So the first thing, I want to start by kicking it off with a story. As a first responder, I've worked in the private sector in various sort of settings. One of the things that I've come across a handful of times is rings being caught on people's fingers. You know, you try and get them off with soap, and you know, I've tried the string trick where you put string underneath and you wind it around the finger and pull it off. That doesn't always work, guys. Once it swells to a certain point, that ring is not coming off unless it's cut off, okay? A ring cutter is important, guys. Like in a survival context, let's say, you know, if you fall into a campfire and you was wearing your wedding ring and you burn your hand pretty badly and your fingers start to swell, that ring is going to ensure that you lose your finger, I guarantee it. But if you've got a ring cutter which costs pretty much nothing, it costs a couple of quid, you can easily cut that ring off, get it off, and you do probably need a pair of pliers to go with it, and you're good to go. You've just got something off which was going to strangulate that limb, and you would essentially have lost that limb. And you know, if you was in a survival situation, let's say, this isn't even just for survival situations, it's for everyday life as well. But if you didn't have somewhere to go to get help, you know, having a ring stuck on your finger, you know, your finger is basically, unless you cut it off yourself, it's probably going to turn gangrenous and die, and yeah, it's going to be a whole mess that you do not want to deal with. So the next thing that I'm going to put on the list is a magnet. Okay, you can get specific magnets. Be careful if you do this with one of those magnets that's double-ended, because you can end up pushing things in further. But for your eyes, your ears, a child's nose, you know, if they put things in their nose, generally it's for eye splinters, but you could use it in wounds as well, where there's like splinters inside. A magnet that draws things towards it and pulls things out of places where you don't want it to be. You know, there's nothing worse than having something in your eye or having something in your ear, or you know, having sharp splinters inside wounds and whatnot. So the ability to get that out yourself, you know, it's a no-brainer, guys, and these don't cost a lot of money as well. Number 3 is a blood pressure cuff. I talked about a blood pressure cuff in a video recently, how it is a better alternative, in my opinion, to tactical tourniquets, because you can use it in a survival context all the time. Survival aside, when we're not surviving and fighting for our lives, generally speaking, it's just everyday issues. You know, maybe your partner is feeling faint, so you take a blood pressure reading and you realise, oh, their blood pressure's slightly low. Have you drank any water today? No. Okay, well that makes sense. Okay, drink some water. It's these sorts of situations, but you've got the added benefit that putting a blood pressure cuff on a wound, above a wound, it will tourniquet that limb and stop the bleeding. You know, and then you can deal with the wound. You can clean it out, pack it full of gauze, bandage it, you know, and then, you know, if you release that tourniquet and it stopped the bleeding, then happy days. Number 4 is activated charcoal. Activated charcoal, guys, is a type of medicine that's given in emergency medicine and pre-hospital care. It's given for poisoning, basically. You know, if you've got a dog that eats chocolate, generally speaking, people give it activated charcoal. We've done that in our household. It does work. A child that, you know, puts something in their mouth and swallows it that they shouldn't do, something that's toxic, activated charcoal. Within 30 minutes or so, before that can pass into the system, you've basically absorbed all the toxins into that charcoal, or most of them, and it saves the liver from damage. It saves the body from a whole host of problems. There are certain poisons that, you know, you don't use this for. I believe bleach is one of them, if people ingest bleach, because by the time it gets to the stomach, it's done the damage anyway, and the charcoal just makes it harder to see what's going on. From the case studies I've read, obviously it's not a field that I've worked in per se. So activated charcoal also can be used for like intestinal gas and things like that. It's just a useful thing to have, guys. Electrolytes. This one is so important, especially with the context of the way things are going in the world. Like, I'm moving to Europe soon, and the temperatures are just through the roof. Electrolytes can definitely save your life, but yet so many people don't have them. If we had an outbreak of cholera or dysentery or some kind of diarrheal disease, now in developed countries like England and the US and Australia, all these different countries, Europe isn't a country obviously, but your European countries, you are not really going to see a high mortality rate for these illnesses. But if there was a mass pandemic like COVID that had diarrhea as one of its symptoms, I'm talking about one of the main symptoms is diarrhea, you would see a lot of people dying, and the healthcare provisions would just be overwhelmed. Having ample amounts of electrolytes, or being able to create your own, it's a lifesaver, guys. You definitely need to consider that. You know, I did a video about proctoclysis not all that long ago, a proctoclysis kit. You have to put electrolytes into the fluids that you would give rectally to be able to make it work. Otherwise, you're just giving them an enema. So, generally speaking, electrolytes are also good for proctoclysis, which is an alternative to IV therapy for those that can't do that. So, yeah, also another thing that you should have. Pocketbooks. Medical guidebooks that are pocket size. I have several of these. I have the JR Calc Ambulance Guidelines. I have various different clinical medicine guidelines. I have 2 different books on that. I also have an A to Z guide of drugs and medicines, a UK version one. That tells me everything about, you know, from drug interactions to what a drug is. If I was out, you know, and I found some tablets and I didn't know what they were, I could refer to this book and I'd know exactly what they're for. You know, it's useful because you never know when the internet is going to not be available. So pocket guidebooks on everything from first aid to general medicine to, you know, drugs and medicines. Like, it's useful to have, guys. Like, it really is, to be able to refer to something that's a bit more advanced, so you can have a bit more of an idea, even if it's just when maybe you've spoke to a healthcare provider on the phone and you don't quite understand the term that they used. You can refer to that, you know, no biggie. A tick remover, that is the next one on the list. A tick removal card, or, you know, something similar to that that's specifically for removing ticks. If you get a tick, I've had 2 ticks in my time after travelling, mainly to Scotland actually. I've removed them with tweezers, but I've always been quite worried that I've left something inside, and that can lead to a whole host of problems, localized infections, Lyme disease, etc. A tick remover also makes it safer in the sense that the tick won't necessarily regurgitate, you know, the contents of its body inside your body and guarantee that you might get Lyme's disease. So on the same topic as that is a magnifying lens or a Fresnel lens of some sort that you can look at skin rashes, look at insect bites, look at foreign bodies, splinters, wounds. You know, you can put it in front of the eye if you think someone's got something in their eye and you can't quite see. You know, all of these things a magnifying glass is super useful for. And it's cheap as well, guys. It's just worth having to be able to see a close-up view of maybe what a rash is, or an infection of some sort on the skin, or it's useful, guys. So next I'm going to talk about is kinesiology tape. So kinesiology tape is basically a type of physiotherapy tape. It's awesome stuff. I use it for blisters in particular, but it's basically a type of tape that will stay on for days, if not weeks. You can shower with it on, and then you just dab it dry, and it dries on its own. This stuff is awesome. It's great for friction points where you might get blisters. It's also great if you want to keep a dressing on longer. Maybe you've got a silver dressing or something like that, and you need it to stay on, where a plaster can easily wash off, or be sweat off. You're sweating and the glue just comes loose. So it's great as an adhesive tape it's made for athletes, so you know that it's going to work when you're sweating and whatnot as well. So Kinesiology Tape, definitely something worth investing in as well. A syringe. So I'm not talking about anything with a sharp needle, just the syringe that you can squirt water or saline out of, or you can suck something up into. This is great for suctioning things, like if you've got a big enough syringe, which I do recommend syringes on the larger side. You can suction objects out of areas that they shouldn't be, or fluid out of the airway, let's say, or mucus out of a nose or something like that. It's more for an emergency sort of practice, but you can also syringe wounds to clean them and to get the right amount of pressure to get any sort of gunk out of that wound. Obviously, if it's a major wound or a major medical emergency, just call the emergency services. It's not, it's useful to have this stuff, but if you can get help, then get help, is what I'm saying. So the next two items are a bit more advanced. So a nasopharyngeal airway is the first one I want to talk about, and get a small bottle of water-based lubricant or sachets of water-based lubricant to lube it up so it can go in, and maybe get some training to actually use this as well. It's not hard to use, but it's always good to train professionally for this, because if you mess it up, then generally speaking there are consequences. So a nasopharyngeal airway, basically, I say this one because it can be put into a patient, and once, let's say that they're semi-conscious or unconscious, it's it's not a biggie. I've actually tried to put one in myself when I was conscious, and I've actually had someone try and put one in me after having a few beers at a hot tub. Wouldn't recommend that one either, guys, but I just wanted to see what it was like. It's really uncomfortable if you are awake and you're conscious. So it's for semi-conscious and unconscious patients. It will basically sit at the back of the airway. It will stop the tongue from occluding the airway, and it will basically keep their airway patent. And if they come round and they're conscious, they can tolerate it as well. So it's definitely a useful thing to have. And failing that, it's a tube. It's a rubber tube that might have other uses. Last thing on the list is splints. Okay, so the amount of times I've had to deal with fractures of some sort in my jobs as job roles as a first responder, it's definitely a percentage of jobs that I've dealt with, like I would say 15% at least, just off the top of my head. So having like a SAM splint which rolls up, rolls down is great. You can also utilise something like this, which is basically just newspaper that's been taped together. This was for another video recently, you have to look out for that. But generally speaking, having something that's ready to go in your first aid kit, like a SAM splint, is super useful. You can just apply it to a fractured arm, pretty much most fractures of the limbs, ankles, things like that. You probably need bigger splints if you want to deal with other things. If you want to get more sort of technical with things, you could look at getting yourself a traction splint, or at the very least learning how to improvise a traction splint for a fractured femur. So fractures to the legs can be life-threatening. So we generally, applying traction to that, especially if you're in a wilderness setting, the majority of deaths in wilderness settings, believe it or not, come from falls and drowning. So you're more likely to fall over and break your leg than you are you know, doing most other things. You know, sliding down a ravine and breaking a bone, it happens all the time, guys. But having a traction splint, or the means to improvise a traction splint, is definitely something that most first aid kits are lacking. And when it comes to like prolonged care windows, you know, if help isn't coming for a short time or even a long time, applying a traction splint could definitely save your life. It will stop you from bleeding internally to death, essentially. So another thing as well would be something like a SAM pelvic binder. I'm not sponsored by SAM Medical at all, I just like their products. It gives just the right amount of force to pull the pelvic girdle back together when it's fractured. Pelvic fractures can be life-threatening. You know, you can lose up to 2 litres of blood. You're basically going to die. Pretty much anything after that, you're pretty much probably going to die at 2 litres potentially as well of blood loss. So, you know, a traction splint and a SAM pelvic binder, that could definitely save your life. Everybody talks about tourniquets in sort of like the survivalist and preparedness world, but actually, like, they don't realise, a lot of these people, that something like a traction splint or a pelvic binder is just as important. Anyway guys, I hope that was useful. This video was just designed to make people a bit more medically self-reliant, from everything from minor ailments all the way up to sort of more severe stuff. But generally speaking, you know, getting adequate training to use a lot of this kit is always a bonus, especially some of the more advanced kit for more advanced injuries like a pelvic fracture or like an airway that's closed and you want to put an NPA in. So there's loads of different items that I've listed, and all of them have a place, and most of them are not in people's first aid kits. The place that they should be is in your kit. So yeah, like I say, I hope that was useful. Please let me know in the comments what you think. There are other items that I could have included, but I just included ones that, you know, are actually useful for general day-to-day things that actually could be a real life or limb saver. You know, if you've got a metal shard in your eye and help isn't coming, you could go blind because of that, or you could get sepsis or something along those lines. Same as if you get a ring caught on your finger. You know, it's the one thing that people overlook, but yet will probably need more so than anything else. Like, I guarantee it, like, the majority of my work as a first responder was dealing with stuff like this. It was dealing with a ring caught on someone's finger, something in someone's eye, like, you know, fractures, suspected fractures, taking blood pressure readings because someone feels faint or because they might have a heart condition, or there's so many different things, guys, and that's what I've tried to incorporate into this list, because most people just don't really think about these things. They buy a first aid kit and they think that that's sufficient, but realistically you need to know what you might be facing, and these are the things that you probably are more likely to face. These are the sorts of things that, you know, people have to go to hospital for, and they're silly little things, some of them. So yeah, please do like and subscribe anyway, guys. Please let me know in the comments what you think. Let me know if, you know, there's something that you think I should have added to that list and taken something else out, maybe. Like I say, there's so many items that I could have put in, but I just chose the ones that are probably the most useful. I mean, there's things like ammonia smelling salts and, you know, a sting pen or things like that. There's things that I could have put in, you know, but I just, you know, at this stage, I just thought these were the most useful. Anyway, thanks for watching, and until next time.